Good afternoon. I'm Dr. Conard, a resident of Manatee County. The comments that I'm going to make, I want to be very, very clear that I am in no way taking any shots at the professionalism that we have in the leadership of our hospitals, the leadership that we have in our rural health, or the leadership that we have in our Manatee Glens. I would suggest to you that Kevin Delala and Dan Frederick and Mickey Perche and Mary Ruiz are excellent professional people, and we're blessed to have them in this community. What I think you've heard today very easily expresses just how complex healthcare is. Healthcare is the most complex industry in America today. That was a statement that was made back in 1994 by the late Peter Drucker, who was an economist of great renown. And what you also heard today is just the tip of the iceberg. As you heard Mr. Delala and his representative relate, easily you can discuss four things that are tragically facing the hospital industry, the first being Medicare. This country has a $90 trillion unfunded liability in Medicare. The 2010 Patient Protection and Affordable Care Act literally sliced $45 trillion out of that without our government relating how they plan to do it. I would suggest to you that the hospitals are going to be very concerned in their reimbursement and such as that as Medicare and its benefits diminish. You heard about Medicaid with the 2010 Affordable Care Act. As it gets implemented by 1114, which we've just gone through, every American has the right for basic health care services. It was perceived that this was going to occur by expansion of Medicaid in the state of, and many of the states did their own insurance exchanges to accomplish that. Florida chose not to do that. That's going to have a huge, huge negative effect. Shut that phone down. Negative effect on every hospital in our state and, in fact, in the country. You heard about disproportionate share of patients. Affordable Care Act is going to diminish those payments to the point that they will probably go away. You've heard about what's happening with the cost of health care insurance. It's greatly going up because in 2017, the supplements that they get from the federal government are going away. So you've really only heard the tip of the iceberg. And I would suggest that you're having your conversation today because in 2008, when the commission at that time collapsed the trust, that commission did not take the advice of our county administrator, who very much encouraged that the issues start to be dealt with. And the reason that they didn't at that point is because 15 years earlier, when they took the management of those funds away from Chip Shore, they didn't start to discuss the issue. So what you as a commission have, I think, the responsibility for is you have to absolutely articulate what is your role and responsibility in the delivery of health care here. I think you need to encourage the people who deliver health care, hospitals, facilities, clinics and such as that, to go away and have a retreat together and come to you with what will accomplish an affordable, accountable, and accessible delivery system. That will then allow you to initiate dialogue